Having a baby is a life-changing event. It's a time of immense joy and love. But it can also be a time of significant emotional and physical adjustments. Many new mothers experience mood swings after childbirth. This is completely normal. Your body is going through major hormonal shifts. You're also adjusting to new routines and sleep deprivation. It's no wonder you might feel like you're on an emotional roller coaster. Remember, you're not alone in this. Postpartum mood swings are very common. Most new mothers experience some degree of emotional ups and downs. These feelings are usually temporary and manageable. Baby blues is a term used to describe mild mood swings that happen in the first few weeks after delivery. These are very common, affecting up to 80% of new mothers. You might feel happy one minute and tearful the next. It's like your emotions are on a seesaw. Common symptoms of the baby blues include mood swings, tearfulness, irritability, anxiety, sadness, and difficulty sleeping. These symptoms usually appear within a few days of giving birth. They typically peak around day 4 or 5. Then they gradually subside within a couple of weeks. Postpartum depression, or PPD, is a more serious condition that requires professional help. It's not just feeling down or being a little sad. PPD is a real medical condition. It affects about 1 in 7 new mothers. It involves intense and persistent feelings of sadness, anxiety, and despair. These feelings can interfere with your ability to care for yourself or your baby. Symptoms of postpartum depression can vary from person to person. However, some common signs include persistent sadness and hopelessness, loss of interest in things you used to enjoy, feelings of guilt, shame, or worthlessness, difficulty concentrating or making decisions, changes in appetite or sleep patterns, and thoughts of harming yourself or your baby. PPD symptoms can appear any time within the first year after childbirth. Section 4. Baby blues versus postpartum depression. Knowing the difference. It can be tricky to distinguish between baby blues and postpartum depression. The symptoms can overlap. However, there are some key differences. Baby blues are temporary and generally mild. Symptoms usually fade within a couple of weeks without treatment. Postpartum depression is more severe and long-lasting. Symptoms persist for more than 2 weeks and can worsen without professional intervention. Here's a simple way to think about it. Baby blues means feeling down or blue, but you can still function and enjoy moments with your baby. Postpartum depression means feeling overwhelmed and hopeless, making it difficult to care for yourself or your baby. If you're unsure whether you're experiencing baby blues or postpartum depression, it's always best to err on the side of caution. Talk to your doctor or midwife. Section 5. Seeking support. You don't have to go through this alone. If you're struggling with postpartum mood swings, whether baby blues or postpartum depression, remember that you are not alone. Many new mothers experience similar challenges. Reaching out for support is crucial. Talk to your partner, family, friends, or a therapist. Don't be afraid to ask for help with childcare, household chores, or anything else that feels overwhelming. Here are some guidelines on when to seek professional help. Your symptoms last longer than 2 weeks. Your symptoms are severe and interfere with your daily life. You have thoughts of harming yourself or your baby. Remember, seeking help is a sign of strength, not weakness.